Okay, let's do upper trunk rotation. One of the most difficult parts of this exercise is actually the setup. So here's what we're looking for. You can kind of start like I am on your side in the comfy position, but then we need to bring the knees up to a 90-degree angle with the hip. And also when you lie down, this is really important, you want to make sure to bring the shoulder back also aligned with your hips. Most of us, when we lie down, we kind of go in the comfy position and we bring the bottom shoulder in front of us. But we can't do that in this exercise, or we're already starting at a disadvantage and out of alignment. So rather you're gonna lift and bring your bottom arm back so that your shoulders are stacked directly over one another. Okay, but first things first, let's get to the knees and hips. You're going to slide, you're going to make sure the knees are lined up, one on top of the other, and a 90-degree angle at the knee and between the lower leg and the thigh. Okay, and a 90-degree at the torso and hips. So I kind of look at all that, then I lie down. Remember to pull that bottom shoulder back. It's not as comfortable, but because you're lying directly on this shoulder, but it will make a big difference doing the exercise. So then you're going to take your top arm and place it right directly over the bottom. So you'll notice that my arms and my thighs are parallel. And if by chance when you lie down, that bottom arm is longer than your top, that just is more of a reminder to pull that bottom shoulder back directly underneath you. You can use a pillow or not use a pillow. It's whatever's most comfortable. In this exercise, it's so important that we have no neck pain. So you're going to want to position your head to make sure that your neck is comfortable. So let's do this. I got my arms at the night parallel with my thighs, and the first thing we're going to do is discuss what not to do. So let me sit up for that so you can hear me a little bit better. The most important part of this exercise is that we force the motion to the upper back, to the thoracic spine. We're going to prevent lumbar movement. No low back lumbar mobility. To do that, you have to keep the knees stacked over one another and not let them slide back even a millimeter. Can you see what I just did? That little slide back. So if I show you at an angle that might be easier for you to see, you're not going to allow this. Another way to think about it is you're not going to let your pelvis move. So here's your pelvic bone. You have your hip bone, then the pelvis. The pelvis, the hips, the knees, nobody is allowed to move even a millimeter. That's so important. Now, to make sure that nobody moves down here, I'm just going to let you in on a secret that the hip flexor muscle called iliopsoas is going to be working pretty hard in this exercise. The bottom leg tends to work a little more than the top leg, so you might notice that. And that's going to be the most important part, because if you can keep this lower half from moving, you force the motion into the upper back, the thoracic spine, which is why we're doing this exercise. We are trying to mobilize T1 through T12, your whole upper back. It's like 50% of your spine, because it was designed to give you the most triplanar mobility. This is where we should be reaching, and when we step, we need freedom in the upper back. And if we're stiff there, then the lower back and the neck pay the price. So to remedy low back pain, neck pain, we do upper trunk rotation and we start getting the thoracic spine free. We also treat shoulder pathology with this very exercise as well. Okay, so you now know the most important part is not to let these lower legs move, even a millimeter. you're going to make sure that you're lying directly on that bottom shoulder so that your arms line up and pull up to my 90 degrees. And then I'm going to just fake it till I make it. I'm going to put a little bit of a curve in my low back because there should be an arch in the lumbar spine naturally. If you were looking from on top of me, my ear should be over my shoulder, over my hips. So I'm going to just make sure that looks like that. Okay, so it's quite a lot to get the setup, right? But here we go. Now, remember nothing moves here. So I'm going to begin by lifting my top arm like I'm opening a book. And I'm going to take my eyes and follow my hand through the movement. And right here, as the fingertips are facing the ceiling, that's when you want to stop or slow down the motion, because this is the point where you need to remind yourself and become vigilant about the lower legs not moving. So here I go, okay, now I can't slide back even a millimeter, but I'm going to continue on my journey on the upper part of the body, and I'm going to let my head and my eyes stay facing the ceiling as my arm continues to lower. And one more point here, as the arm lowers, keep the arm aligned with the shoulder blade. In other words, don't let it hang soft because that might be too much strain on the ligaments of the shoulder. So I'll show you from both angles. That will become more evident from the other side. But here we are again. I start up and I begin to open my book and I turn my head to follow my hand until my head is looking at the ceiling. And then I can just make sure my neck is comfortable. I can continue the movement with my arm. And I'm going to angle the arm slightly up. So instead of straight, I'm going to angle up, and then I'm going to continue to turn, not allowing the lower part of my body to move. And then my arm's just kind of hanging in the air because I haven't stretched yet today. And my head's pain-free, so my neck is pain-free, excuse me, so I'm good there. And I can now just take a deep breath in. And on the exhalation, I'm just going to allow my upper torso to soften and my shoulder blade, my right shoulder blade, to soften towards the floor. Another deep breath in. And on the exhalation, I release and intend for my shoulder blade on the top side, right under my hand here, to move towards the floor. So I'm going to turn back to talk to you. Now, while this arm is back here, I want to invite you to have the sense that your legs are moving away from your torso. So that's another way not to overwork and cramp these psoas, but to allow them to naturally stabilize the low back. So natural stabilization is not over contraction. So for that, you're going to have the sense that your thighs are moving away or out of the hips. So I'm back here, I'm on my shoulder, I'm here, I didn't let my knees move. And here's when you have the sense that your thighs are moving away. And then you can continue your breathing, inviting the shoulder blade towards the floor. So it's not about reaching and touching the floor. It's about the shoulder blade, the upper torso moving, and then the arm naturally is the weight for that to take place. If you have shoulder pain, lift your arm up a little bit. You also could stack a bunch of pillows under your arm to support you. But remember, your arm's not just like hanging on the ligaments. You're keeping it aligned with your armpit, would be a way to think of it, your torso, your shoulder blade, and yet it does rest in the air as you exhale it into that rotation. It's the exhalation where the body can begin its fascial unwinding. So that's really important. And it's also okay to turn back every now and then and just make sure that these legs haven't moved. Sometimes at my clinic, we tell people that they can put their knees against a wall or a door frame, and that will give you some feedback if you move away from something, if you'd like, but you're welcome to do it without that as well. So I think we got most of the main points. I'm going to stop this video and then show you from the back side what it looks like, and that will explain that torso going towards the floor a little bit better. Okay, see you on the next video.